Welcome to Infection Prevention Trainee Orientation at VA Pittsburgh. Our goal is to equip you with practical skills to protect veterans, staff, and visitors from healthcare-associated infections. Over the next slides, we will cover hand hygiene, PPE, environmental cleaning, and safe device use, so you can practice safely from day one. Hand hygiene and PPE start at the doorway. Clean your hands on entry and exit, and during every key moment of patient care, before touching the patient, before aseptic tasks, after fluid exposure, after patient contact, and after touching surroundings. If a precaution sign is posted, wear the indicated PPE every time. Use soap and warm water when hands are visibly soiled, after restroom use, eating, or caring for patients with diarrhea or C. Difficile. Rub all surfaces for at least 15 seconds. Use alcohol-based hand sanitizer when hands are not visibly dirty and for routine in and out care in veterans' rooms. A frequent mistake is putting on gloves over contaminated hands. The images show bacteria present both before and after gloving when hand hygiene is skipped. Always perform hand hygiene before donning gloves so that we do not trap organisms inside and transfer them between patients. The Take 5 campaign reminds us to pause for clean hands. First, pause to clean your own hands and don PPE correctly. Second, pause to remind coworkers to do the same. Third, pause to help veterans clean their hands and understand when and how to wash or sanitize to prevent infection. These color-coded signs indicate isolation-based precautions such as airborne, droplet, contact, and Contact Plus. Before entering a room, stop and read the sign carefully. It tells you which PPE is required and any special instructions so that you can protect yourself and prevent transmission. When donning PPE, follow the correct sequence after hand hygiene. First, put on the gown and secure it fully. Next, add respiratory protection. A mask, respirator, or PAPR is indicated. Then apply eye protection such as goggles or a face shield. Finally, don gloves. Remember, gloves are always last. Doffing PPE is high risk for self-contamination and should occur inside the patient room, not in the hallway. Begin by removing gown and gloves together. Grasp the front, break the ties, and roll the gown away from your body, turning contaminated surfaces inward as you bundle it with the gloves. After removing gown and gloves, carefully doff eye protection without touching the front, then remove your mask or respirator by the straps. Dispose of PPE appropriately. Immediately perform hand hygiene to remove any organisms acquired during removal before you leave the room. This room image highlights how many sites can culture positive for VRE. High-touch surfaces such as rails, monitors, pumps, and bedside tables are frequently contaminated. Because we cannot see pathogens, we must never assume it is safe to skip precautions in any patient care environment. Pathogens can persist on dry surfaces for days to months. C. difficile spores up to 5 months. Studies show frequent contamination of hands and gloves, even with short room visits or simple tasks like taking vitals or touching bed rails. Therefore, consistent hand hygiene and PPE use are essential. Hands are only part of the story. Stethoscopes and other equipment contact multiple patients and can transmit organisms if not disinfected. After each patient encounter, wipe the diaphragm and tubing with an approved disinfectant wipe, observing the required wet time before reuse. Different wipes have different required wet times for effective disinfection. Bleach wipes must keep the surface wet for 3 minutes, PDI Purple Top for 2 minutes, and alcohol wipes are effective once the surface air dries. Always read the label and ensure equipment remains visibly wet long enough. To select appropriate PPE, use a 3-step process. Think, select, don. First, think about standard and any transmission-based precautions. Second, select PPE that matches the anticipated exposure. Third, perform hand hygiene and then don the chosen PPE before entering the patient care area. In practice, we often need both standard and transmission-based precautions. For example, a patient with a draining wound on droplet precautions may require gown, gloves, and mask. Use the Think Select Dawn framework and the room's isolation sign to choose all necessary protection every time. Many hospital-acquired infections are linked to invasive devices, such as urinary catheters and central lines. Every device breaks the body's natural barriers and provides a pathway for pathogens. Our responsibility is to justify each device, maintain it aseptically, and remove it as soon as possible. Timely removal of urinary catheters is a key prevention strategy. Use the nurse-driven protocol and indications chart to confirm that each Foley remains clinically necessary. If a patient no longer meets criteria, advocate to remove the catheter and reassess frequently to minimize infection risk. Preventing hospital-acquired C. Difficile requires multiple steps. Avoid unnecessary antibiotics, perform meticulous hand hygiene with soap and water, use contact precautions with gown and gloves, and clean the environment with a sporicidal bleach product. Together, these actions interrupt transmission. We continue contact precautions for 30 days after C. difficile treatment because patients may still shed spores. Shedding falls during therapy but rises again once antibiotics stop, creating a high-risk period of recurrence and environmental contamination. Extended isolation protects everyone. If you are unsure when to start or discontinue precautions, or have any infection prevention question, contact the Infection Prevention Team at VA Pittsburgh. Use the listed phone number rather than calling ID on call. Partnering with us ensures safe, evidence-based care for our veterans.